Hi, I'm Acta, the Compliance Officer here in the Central Division, and I'll be bringing to you this week's installment of the Right Way Wednesday. I'll be speaking to you about progress towards short-term goals. Progress towards short-term goals is that little section at the bottom of the progress report. As an auditor, I often see that section missing some components that were intended to be documented there. Many times I see documentation stating patient has met 2 out of 3 short-term goals, or patient has improved from mod-assist to min-assist with sit-to-stand transfers. Although this is not incorrect, this information is simply restating what is already in the goals section of the progress report. The progress towards short-term goals section was intended to also include how the patient's quality of movement has changed and how their progress or lack of progress is impacting their burden of care. So in the case of the patient with whose transfers improved from mod-assist to min-assist, it is best to document the improvements in impairment that led to the need for less assistance. This may be the patient's increase in core strength, allowing the patient to hinge forward with less trunk support, or it may be an increase in quad and hip strength, allowing the patient to lift themselves from the chair with less assistance. Other times, it may even simply be the patient's carryover with the education on technique with the movement. Either way, it is important to document how the quality of movement has progressed or not progressed in the progress toward short-term goals section of the progress report. If the patient did not progress, then it is important to identify the barriers leading to the lack of progress. In addition, documentation on how the patient's function is improving outside of therapy is imperative and can easily be retrieved when speaking with the patient, family member, or other providers within the building. Thank you very much. I hope you enjoyed this week's installment of the Right Way Wednesday. Enjoy the rest of your day.